Posology. Factors affecting dose and action of drugs. There are various factors influences the dose and action of a drug in an individual person. They are age. Age is the important factor having significant role in fixing the dose of a drug in child, adults and in old persons. The children and old persons need lesser amount of drug than adult dose. The drug's absorption and rate of elimination are varied with that of adults. Children cannot tolerate large doses of potential drugs. Newborn infants are sensitive to certain drugs. This is due to the immune state of their hepatic and renal function by which drugs are normally inactivated and eliminated from the body. Body weight. Adult dose normally recommended on the basis of normal body weight of 70 kg. This dose will be too less for a person weighing 100 kg and too large for a weak person weighing 50 kg. The calculation of doses for children on the basis of body weight is considered than age. The doses calculated according to body weight are expressed as milligram per kilogram body weight. Sex. The females are more responsible to certain drugs than males. So female require lesser dose than males. Drugs should be given very carefully. During menstruation, pregnancy and lactation period. The drugs which stimulate contraction of uterus should be avoided in pregnant ladies. This may lead to abortion. Drugs like alcohol, barbiturates and narcotic analgesics are transported from mother to fetal circulation. These drugs produce adverse effects to the fetus. During lactation period, the drugs like antihistamines, morphine and tetracyclines should not recommend because they are excreted in milk and affect the babies. Route of administration. Drug administered through oral route require large dose. Drug administered through intravenous route may require less dose than the oral dose. Because drugs administered IV route enter the bloodstream directly and produce quick onset of action. Time of administration. Time of administration is very important. Some drugs are rapidly absorbed from empty stomach. This may lead to toxic effect. Such drugs should be administered during or after meals. The GIT irritating drugs are better administered after meals. Antacid drugs are admitted before meals. Presence of disease. Drugs are more effective in diseased conditions than normal conditions. During fever one can tolerate high doses of antipyretics than non-fever condition. Drugs which are metabolized in liver and excreted through kidney are not suitable to recommend during hepatic and renal failure. Environmental factors. Dose of particular drug is effective with that of the environmental factor. Alcohol is better tolerated in cold environment than in summer. Dose of sedative drug required to produce sleep after administration. So such type of drug is better recommended to take in the night than daytime. Emotional factors. Females are more emotional and responsive to drugs. Therefore female require less dose of drugs. The nervous patients require smaller doses of drugs as compared to normal patients. Accumulation. When a drug is repeatedly administered for a long time leads to accumulation in the body. This may produce sudden toxic symptoms. These drugs are called as cumulative drugs. Therefore drugs like digitalis, emmetine, bromides and heavy metals should be carefully administered. Sometimes the cumulative effect is desirable in drugs like chloroquine and phenobarbital which are used in treatment of malaria and epilepsy respectively. Synergism. When two or more drugs are used in the combined form, their action is either increased or decreased depending on the drugs used in combination. When the potency or duration of action is increased, the phenomenon is called synergism. The synergism is of two types. A. Addition. When total effect of two drugs is just equal to the sum of their individual effect is known as addition effect. B. Potentiation. When the combined effect of two drugs administered is greater than the sum of their individual effect is known as potentiation. X. Combination of ephedrine and adrenaline acts as better bronchodilatory. Antagonism. When the action of one drug is opposed by the other drug the phenomenon is known as antagonism. Example: adrenaline is vasodilatory. The efforts are antagonized by acetylcholine which is constructor. Sometimes the antagonism effects are beneficial. Example: milk of magnesia is an alkaline drug. It antagonizes the acid poisoning. Habituation. When repeated use of a drug that leads to production of emotional or psychological dependence the condition is known as habitation. X. Use of tea, tobacco, chewing of betel nuts, tranquilizers etc. When such agents are withdrawn the individual can carry on his routine work. As there is no physical dependence, it can be easily tackled. Addiction. It is the state of psychic and physical drug dependence. Continuous use of alcohol, opium, cocaine, heroin, morphine, pethidine, LSD types of drugs leads to addiction. The addicts are deeply attached to the drug and become slave of the drug. If he is unable to get the drug, he develops withdrawal symptoms which may be serious enough to produce death. So the drugs which leads to addiction must be prescribed very cautiously. Idiosyncrasy. All persons do not respond alike to the same drug due to varied individual susceptibility. Some persons may produce abnormal reaction to a drug. When an abnormal or unusual reaction is produced by a drug, it is known as idiosyncrasy. Aspirin drug may produce gastric hemorrhage. Small doses of quinine may produce ringing in the ear. Hypersensitivity. Hypersensitivity is an allergic reaction to a drug and is different from either the expected pharmacological response or toxic reaction to the drug. This is due to frequent or indiscriminate use of drugs like antibiotics, vitamins, etc. Once a person is sensitized, a minute dose of the drug will produce allergic reactions. It is of two types. Immediate type, which is serious and requires prompt injection of adrenaline, otherwise death may occur. Delayed type, in which urticaria, skin rashes may occur. Tolerance. When a drug administered in an ordinary dose fails to produce the normal therapeutic effect. Require large dose of the drug to produce the normal effect. The unusual resistance thus produced is known as tolerance. Smokers can tolerate nicotine. Alcoholics can tolerate large doses of alcohol. Tachyphylaxis. It is also known as acute tolerance. Certain drugs are administered repeatedly at very short intervals. The cell receptors get blocked. The pharmacological response to that drug is decreased. By increasing the dose, this decreased response cannot be reversed. But if the administration of the drug is stopped for a long time and administered again after being discontinued, then the initial effect if the drug can be reobserved. This condition is known as tachyphylaxis. Drugs like ephedrine, amphetamine, cocaine and nitrites behave in this way. Thank you.